Part A. Extract 1. Questions 1 to 12. You hear a pediatrician talking to a patient called Mihira. You now have 30 seconds to look at the notes.
Good morning, Mihira. How can I help you today?
Good morning, Dr. Drew. I'm really worried about my son, Oliver. He's been having these terrible coughing fits, and I'm not sure what to do.
I'm sorry to hear that Oliver is unwell. Let's start from the beginning. Can you describe his symptoms for me?
Yes, certainly. It all started a couple of nights ago. He woke up in the middle of the night with a very harsh barking cough. It sounded almost like a seal barking, and it really scared me. He also seemed to be struggling to breathe.
That sounds quite distressing. Has he had a fever or any other symptoms?
He did have a mild fever the first night, but it hasn't been too high. Mostly it's this awful cough and his difficulty breathing, especially at night. During the day, he seems a bit better, but still has that cough.
I see. How old is Oliver?
He's 3 years old.
And when did these symptoms begin exactly?
It started 2 nights ago. During the day, he had a bit of a runny nose, but it wasn't anything serious. Then, in the middle of the night, he woke up with that terrible cough and seemed to be struggling to breathe.
Have you noticed any triggers that might have caused his symptoms to worsen?
Not really. We haven't done anything out of the ordinary. It just seemed to come on suddenly.
Thank you for the details. Has Oliver been around anyone who has been sick recently?
Not that I know of. We've been quite careful with social gatherings and cleanliness lately.
Understood. Could you describe a specific incident when his symptoms were particularly severe?
Yes, the night before last was the worst. Around 2 a.m., he woke up crying and coughing. His cough was so loud and harsh that I thought he was choking. When I went into his room, he was gasping for air between coughs. I picked him up and tried to comfort him, but he just kept coughing. I took him into the bathroom and ran a hot shower to create steam, which seemed to help a little, but he was still having a hard time breathing. It was terrifying.
That does sound very frightening. You did well by using steam. It can sometimes help ease the symptoms. Did you try any other remedies or medications at home?
Yes, I gave him some children's paracetamol to help with the fever and tried to keep him calm. I also used a humidifier in his room last night, which seemed to help a bit with his breathing, but the cough is still very bad.
It sounds like you've done a good job managing his symptoms so far. Based on what you've described, it sounds like Oliver might have croup, which is a common viral infection in young children that causes swelling in the airways and leads to that distinctive barking cough.
Oh, I've heard of it before. Is it serious?
It can be quite distressing because of the breathing difficulties and the sound of the cough, but it is usually manageable and often resolves within a week. The main concern is to ensure that his airway remains open and that he is able to breathe comfortably. It's typically caused by a viral infection, often the same viruses that cause the common cold.
What causes it to sound so harsh? It's really alarming.
The harsh, barking sound of the cough is due to the swelling of the vocal cords and the windpipe, which causes a narrowing of the airways. When air is forced through this narrowed passage, it creates that characteristic sound.
I see. Is there anything specific I should be doing to help him recover?
Yes, there are a few things you can do to help Oliver. First, keep him calm and comfortable, as crying and agitation can make the symptoms worse. Using a cool mist humidifier in his room, as you did, can help soothe his airways. Make sure he stays hydrated by encouraging him to drink plenty of fluids.
What about medication? Is there anything that can help with the coughing?
If Oliver's symptoms are severe or if he has difficulty breathing, we might consider a dose of a corticosteroid, which can help reduce the inflammation in his airways. This medication usually works within a few hours and can make a significant difference. In some cases, a nebulized adrenaline treatment might be necessary, but this is typically reserved for more severe cases and would be administered in a hospital setting.
Thank you, Dr. Drew. I really appreciate it. How long should I expect the symptoms to last?
Extract 2. Questions 13 to 24. You hear a diabetic nurse talking to a patient called Mihira. You now have 30 seconds to look at the notes.
Good morning, Mihira. How are you doing today?
Good morning, Nurse Field. I've been feeling a bit overwhelmed lately, but I'm managing. I'm here for my follow-up visit.
I understand. Can be a lot to take in. Let's go over how you've been feeling. Can you describe any specific symptoms or changes in your health since your last visit?
Well, I've been experiencing some tiredness and occasional lightheadedness. My eyesight gets blurry at times, and I've noticed that my cuts take longer to heal.
Thank you for sharing that with me, Mihira. These symptoms are common with diabetes, but it's good you're monitoring them. Let's review your test results now. Based on your recent blood analysis, it appears you have type 2 diabetes.
I had a feeling that might be the case. What does that mean for me?
Type 2 diabetes means that your body doesn't use insulin effectively, which leads to higher blood sugar levels. We'll need to start managing this with medicine and lifestyle changes. For medicine, your doctor has prescribed metformin. It helps to control blood sugar levels by improving how your body uses insulin.
Okay. Will it have any side effects?
Some people experience stomach issues like loose stools or feeling sick. It usually goes away after a few days. It's important to take the medicine regularly as prescribed.
Okay, and what about my diet? Do I need to make any specific changes?
Yes, diet plays a crucial role in managing diabetes. You'll need to follow a low-sugar, low-starch diet. Focus on eating whole grains, lean proteins, vegetables, and fruits with a lower sugar content. It's also important to avoid sugary drinks and processed foods.
That sounds manageable. What other lifestyle changes do I need to consider?
Regular physical activity is very important. Aim for at least 30 minutes of moderate exercise, such as walking or cycling, most days of the week. Additionally, maintaining a healthy weight is crucial, so we'll work on a plan that includes both diet and exercise to help you reach and maintain your target weight. The aim should be to bring your HbA1c level below 7% over the next few months.
I see. Is there a specific blood sugar level I should aim to maintain?
Yes, Mihira, you should aim to keep your blood sugar levels between 80 and 130 milligrams per deciliter before eating, and less than 180 milligrams per deciliter 2 hours after starting to eat. Consistently monitoring your blood sugar levels will be key in managing your condition.
That sounds reasonable. Is it possible to reverse type 2 diabetes?
For some individuals, it's possible to achieve remission, meaning normal blood sugar levels without the need for medicine. This often requires significant and sustained lifestyle changes, including weight loss and regular physical activity. However, it's important to understand that diabetes management is a lifelong commitment. Even if you achieve it, ongoing monitoring and healthy habits are essential to prevent it from coming back.
Thank you, Nurse Field. I feel more informed now and ready to take the necessary steps.
Part B. In this part of the test, you'll hear 6 different extracts. You'll have time to read each question before you listen.
Ms. Gertrude, I've noticed a recurring pattern of long breaks among the night team. It's affecting how well we can look after patients. For instance, during the last night, Nurse Peter was away for almost half an hour, leaving patients without care. Also, there have been more mistakes with medicines which I think might be connected to tiredness caused by these long breaks.
Mihira, this is a serious concern. Long breaks are not allowed, especially on night shifts. Medicine mistakes are a major warning sign. We need to deal with this quickly. I'll arrange a meeting that everyone must attend to talk about break rules and what they mean. It's vital to stress how important patient safety and responsibility are. We'll also put in place stricter break times and surprise checks. Mihira, I want to assure you that we're taking this very seriously.
Mihira, I need you to change the amount of medicine for Mr. David in room 303. The new drug, bisoprolol, appears to be interacting with his current water pill, causing low blood pressure. Let's lower the bisoprolol by a quarter for now. Check his blood pressure carefully over the next day. If the top number goes below 90, we might need to stop it completely. Also, watch his potassium levels. Water pills can sometimes lower potassium, which can make the low blood pressure worse. If his potassium goes below 3.5, Mihira, we'll need to give him more potassium.
Got it, Dr. Paul. I'll change the medicine order right away and let the pharmacy know. I'll also start checking his blood pressure regularly and monitor his potassium. I'll keep you informed of any changes.
Good morning, everyone. I have an important update. To improve how safe our patients are and to make sure everyone is accountable, we're starting to use a fingerprint system to enter and leave the ward. This means you'll need to scan your finger to clock in and out for your shifts. I know some of you might have questions about privacy and how easy it will be, but this system is really important for keeping correct records of who is working, making sure our patients get the best care, and following the rules. We've picked a very secure system that will protect your fingerprint information. There will be a training session next week that everyone needs to attend to learn how to use the new system. If you have any questions or worries, please come and talk to me or someone from HR.
Did you hear about the new patient Mihira? They brought her in with serious lung infection. She's in room 302. Seems she's an older patient with a history of heart trouble. They're worried about her breathing getting worse, so we need to keep a close eye on her. Also, she's taking quite a few medicines, including water pills, which can affect her potassium levels. 1 Mihira, we need to watch for signs of low potassium.
Lung infection and heart trouble, that's a difficult situation. We'll have to be extra careful. I'll check her oxygen levels every hour and make sure she's resting comfortably. Let's also double-check when she's supposed to get her medicines to avoid any problems. We should probably get a blood test to check her potassium levels too. Poor thing, I hope she gets better soon.
Dr. David, I'm sending over Mr. Thomas for a checkup before his operation. He's having a keyhole surgery next week.
Thanks, Dr. Mihira. I'll set up a time for Mr. Thomas to come in. What does he need to do to get ready for the operation?
We'll need to make sure Mr. Thomas is in the best possible health for the surgery. He'll need to fast before the operation and avoid some medicines.
I'll give Mr. Thomas clear instructions about how to prepare before the operation. Are there any specific worries or things we should watch out for?
Mr. Thomas has a history of high blood pressure and sugar problems. Point 1 will need to manage these carefully before the surgery.
Dr. Mihira, I'll look at his medical history and make sure he's taking his medicines as he should. We'll also need to see if he's at risk of any problems and take the right steps to prevent them.
Hello, Mihira. I wanted to chat about your medicine. The doctor has decided to change your medicine from a liquid to a pill. It's the same medicine, just a different type. The pills are easier to take and might have fewer problems. We'll start you on a smaller amount of the pill and slowly increase it to the amount you're taking now. It's important to finish the liquid medicine before you start the pills so you don't miss any doses. Also, remember to take the pills with food to help your body use them. Do you have any questions?
So I finish the liquid first, then start the pills. And it's okay to eat something with them.
That's right, Mihira. We want to make this change as easy as possible for you. Please tell me if you have any problems or if the pills are hard to swallow.
Part C. Extract 1. Questions 31 to 36. You hear a plastic surgeon talking about advancements in cosmetic surgeries at the Mihira Research Center.
The field of beauty surgery has seen major progress in the last 10 years, especially at the Mihira Research Center, a well-known place for its new research and inventions. These improvements cover many areas, including surgery methods, non-invasive treatments, patient safety rules, use of technology, custom treatment plans, and care after surgery. Each of these areas has greatly improved, leading to better results for patients, increased safety, and more natural looks. In this detailed look, we will explore these 6 important parts, discussing their complex and varied nature, as they represent the most advanced areas of beauty surgery at Mihira Research Center. The Mihira Research Center has created several new surgery methods that have changed beauty surgery. One important step forward is the development of small cut procedures. These methods, like using tiny scopes for brow lifts and small incisions for face lifts, greatly reduce scars, recovery time, and problems after surgery. The center's researchers have also perfected fat-moving procedures, where fat is taken from one part of the body and moved to another to add volume and shape. This method has been very successful in breast and buttock increases, offering a more natural option than implants. Also, using 3D imaging and printing has allowed surgeons to plan and perform surgeries with very high accuracy. Custom implants and grafts can be made to fit each patient's unique body shape, ensuring the best results and lowering the chance of problems. Non-invasive beauty treatments have become very popular because they require little downtime and have less risk compared to traditional surgery. At the Mihira Research Center, big steps have been taken to make these treatments more effective. One such improvement is the use of high-intensity focused sound waves, HIFU, for tightening and lifting skin. This technology targets deeper layers of the skin without hurting the surface, encouraging collagen growth and creating a younger look. Another breakthrough is the development of cryolipolysis, known as fat freezing, which specifically targets and destroys fat cells without harming nearby tissues. Additionally, improvements in laser technologies have increased their uses in skin smoothing, hair removal, and treating blood vessel problems. These non-invasive treatments are often combined with new skincare products and routines developed at the center, which improve and extend the effects of the treatments. Making sure patients are safe is the most important thing in beauty surgery, and the Mihira Research Center has set new standards in this area. The center uses strict checkup processes before surgery to find any possible risks. This includes full health checks, psychological evaluations, and detailed talks about what patients expect and want to achieve. During surgery, advanced monitoring systems are used to track vital signs and ensure the patient is stable. The use of enhanced recovery after surgery, ERAs, plans has also been a significant improvement. These plans involve a team approach to care around the time of surgery, focusing on pain control, nutrition, and getting patients moving early to speed up recovery and reduce problems. Care after surgery at the Mihira Research Center is just as careful, with regular follow-ups, custom care plans, and access to various support therapies to ensure the best healing and satisfaction. Technology has played a big part in moving beauty surgery forward, and the Mihira Research Center is leading the way in using the latest inventions. One of the most impactful technologies is the use of augmented reality, AR, and virtual reality, VR, in planning and training for surgery. Surgeons can see the procedure in a virtual setting, allowing for better planning and accuracy. Robots have also become more common in beauty surgery, especially in procedures that need very high precision, like hair transplants and small vessel surgery. The use of artificial intelligence, AI, in diagnosis and predicting outcomes has further improved patient results. AI programs can analyze patient data to predict possible problems and improve treatment plans and custom care. Also, the use of telemedicine has made expert consultations and follow-up care more accessible, making it easier for patients to get specialized care no matter where they live. Customization is a key trend in modern beauty surgery, and the Mihira Research Center has been a leader in this area. Every patient is different, and custom treatment plans are designed to meet individual needs, preferences, and body shapes. This approach starts with a thorough meeting, during which detailed imaging and simulations are used to see potential results. Genetic testing is also used to understand how a patient might react to certain treatments and to tailor interventions accordingly. Personalized skincare routines, developed based on a patient's skin type and concerns, are another part of this approach. The center also offers personalized wellness programs, which include nutrition advice, exercise plans, and stress management techniques to go along with beauty procedures and promote overall well-being. This complete approach ensures that patients receive comprehensive care that addresses both their appearance and health needs. The improvements in care after surgery at the Mihira Research Center have greatly improved patient recovery and satisfaction. The center has developed a complete post-operative care program that includes pain management, wound care, and physical therapy. Pain management is tailored to each patient, using a mix of medicines, nerve blocks, and non-drug methods like acupuncture and relaxation techniques. Advanced wound care products and methods are used to minimize scarring and promote faster healing. Physical therapy is a key part of the recovery process, especially for patients who have had body shaping and reconstructive surgeries. The center's physical therapists work closely with patients to create custom exercise programs that improve movement and strength while lowering the risk of problems. Emotional support is also available to help patients deal with the feelings related to recovery and getting used to their new look. This complete approach ensures that patients achieve the best possible results and have a smooth and successful recovery.
Now look at Extract 2. Questions 37 to 42. You hear a psychologist called Mihira being interviewed about the various aspects of her 30-year career.
Mihira, you've had an impressive 30-year career in the study of the mind. What first drew you to this field?
My path into the study of the mind started rather unexpectedly. I was originally training to be a school teacher. During my third year of college, I took an optional class in how children develop, which sparked my interest in why people behave the way they do and how their minds work. The complexities of the human mind fascinated me, especially how early experiences shape who we become and how we cope with difficulties. I was deeply moved by the stories of strength and change that I read about in examples. This optional class changed my career path, leading me to get a degree in the study of mental health.
Over the years, how have you seen the field of the mind evolve, especially in terms of how society views it and the progress of technology?
The change has been significant. When I started, there was a strong negative feeling attached to mental health problems. People were hesitant to seek help because they were afraid of being judged. Over the years, increased understanding and education have slowly reduced the stigma. Social media and online platforms have played a mixed role. While they've helped spread awareness, they've also sometimes spread wrong information. Technologically, the arrival of online therapy and mental well-being apps has transformed access to mental health care, making it more convenient and less intimidating for many people. Additionally, progress in brain imaging and genetic research has deepened our understanding of the biological reasons behind mental health disorders, allowing for more specific and effective treatments.
What has been the most challenging part of your career, Mihira?
Without a doubt, the most challenging part has been dealing with the larger issues that affect mental well-being. For instance, financial inequalities often limit access to good mental health care for many individuals. Additionally, cultural differences can create obstacles to clear communication and following treatment plans. Navigating these complexities requires not only clinical skills, but also a deep understanding of fairness and standing up for others. It's a constant balancing act to provide the best care possible while working within these limitations.
Mihira, can you share a particularly memorable case that had a significant impact on you?
There have been many, but one that stands out involved a young woman who was dealing with severe worry and sadness after a shocking event. She was initially very resistant to therapy, which is not unusual. Through persistent effort and building a strong, trusting relationship, we were able to make significant progress. Over time, she learned to manage her symptoms and eventually regained a sense of normalcy in her life. This case highlighted the importance of not giving up and the profound impact of a supportive therapeutic relationship.
How do you maintain your own mental well-being while dealing with the stresses of your profession, Mihira?
Taking care of myself is crucial in this profession. I have a few strategies that I follow strictly. Firstly, I engage in regular physical activity, which helps in managing stress and maintaining overall health. Secondly, I make sure to set boundaries. I have specific times when I am available for my clients and times when I am not. This helps in preventing burnout. Additionally, I seek guidance and support from colleagues. Discussing challenging cases with others can provide new perspectives and emotional relief. Lastly, I practice mindfulness and meditation, which have been invaluable in maintaining mental clarity and emotional balance.
Looking forward, Mihira, what changes or advancements do you hope to see in the field of the mind?
I hope to see a continued decrease in the negative feelings associated with mental health problems, leading to more people seeking the help they need. Technologically, I am excited about the potential of artificial intelligence in making treatment plans more personal. AI could analyze large amounts of data to provide insights that are beyond human capability, making treatments more effective. Furthermore, I would like to see a greater focus on preventing mental health issues, including mental well-being education in early schooling to build resilience from a young age.